devising strategies for managing challenging behaviour, a key step is to remove unpleasant stimuli. Reconsidering ways of touching an older person or engaging with their personal space is important, as these two factors play a role in 72% of aggressive behaviours. Increasing pleasant stimuli is also a helpful strategy. Perfumes, music of significance, as well as positive reminiscence can alleviate aggressive behaviour during personal care. It's important to understand, however, that each individual will require a specific form of management. Generic management strategies will be ineffectual.
And you will find that everybody's unique and their behaviours are unique. So it is very, very hard to generalise and say, well, this worked for one person, therefore it's going to work with the next. Just because of that multifactorial cause of that behaviour.
It will most often not be possible to completely remove the older person from the sort of stimuli that triggers a challenging behaviour. Minimisation of a trigger's impact, rather than complete removal, is a good approach.
So now I know with Mr. X, shouting causes him to be distressed. And so then what I've got to realise is to try and keep him in quieter environments. So I might, in areas where people shout and people can shout, I might put some earphones on him with some soft music to try and figure out. But if that didn't work with him, then I would have to consider where I placed him in that room.
In making changes to the older person's daily pattern or routine, it's best to change only one aspect of their life at a time. Sudden, multiple changes can cause a trauma that may bring on a challenging behaviour.
But one really key factor in that is that you have to involve the client themselves, the resident, the patient, whatever you would call that person. They have to be intrinsically involved in making that decision about how things are going to work. With insight, without insight, that person has to feel some sort of ownership in how that they're going to respond to that, how we're going to modify the behaviour.
It's important to set goals for anticipated improvements in behaviour, as well as to establish regular review timeframes so progress can be effectively monitored. And it's vital to understand that devising management strategies is sometimes a case of trial and error. Successful outcomes may not be brought out immediately.
It may not always work, and it may actually change. And that's unfortunately what will happen, is that you'll have everything work perfectly and you've got a perfect staff response and you've got a perfect reaction and you've averted a behaviour, and next week it doesn't work. And you don't go back to scratch because you've got all the background factors there. It's just, okay, well, that didn't work. What else can we try? And you use your building knowledge to build up from there.
Through the management strategy process, staff should maintain accurate and comprehensive records. Documenting the behaviour itself, the management strategy trialled, and the outcome of that strategy ensures that an effective long-term management program can be set in place. It also ensures that if the older person moves to another treatment facility, a good record of the management program can be passed on to the new care team. It's also critical that staff develop a compassionate, accepting approach towards the older person who is displaying the behaviour of concern. A compassionate approach allows for better understanding, and that leads to a better level of care.
The staff have to be trained to be able to understand the underlying factors of the behaviour and not to personalise. If someone comes up and swears in their face and insults them, they can't feel that that's personal. They have to attribute that behaviour to the person's mental illness, to their brain injury. They can't personalise that, so they can't be judgmental.
Tailor behaviour management to specific individuals. Focus on removing negative stimuli and increasing positive stimuli. Allow the older person to feel a sense of ownership of the management strategy. Understand that creating effective management strategies may require several attempts. Maintain records of the management process. Develop a compassionate approach.